Hi, Dr. Stryker here at SingMedical, your strength for health. We have Zelina behind the camera. She was sharing that a patient called in with a concern, and I thought, yeah, why don't we discuss this online? What did she say, Zelina?
So a patient actually called in and asked in regards to her period. So she haven't been getting her period for 2 months now, and whether it's a concern for her. So what's your input, doctor?
Okay, so we didn't actually see this patient, but what's the vague input? Well, it's quite a broad range of possibilities. It could be serious, it could also not be that serious. Now, if I see a patient whose one period has been late and missed that kind of one period, of course you want to make sure they are not pregnant. You know, that is an often overlooked cause of missing your period. I remember once I was in the polyclinic and I saw a lady in her late 40s and she said her periods were stopping. She thought she was going through the menopause early. I think mid-40s, mid to late 40s. And I was like, it's possible, but of course it is a little bit early. And I said, have you done a pregnancy test? And she was like, no. And I was like, oh, let's do one. And she was like, no, there's no point. She was really adamant. There's no point doing it at all. I was like, let's just do it. You know, you're here, you don't want to, just do it. We did it. It was positive. She was absolutely like mind-blown shocked. So of course, exclude the obvious causes. Pregnancy is there. If you've just missed one period and you've never had it before, and of course you're not sexually active also, so there's zero chance of you being pregnant, I'm usually not that concerned if it's just one, because often there could be just slight fluctuations in your hormones, and we see a lot of patients where they miss one and then the next cycle it comes back and it's fine. And it was just a one-off kind of blip in the cycle, and that's probably nothing. If you find you've missed a few, then yeah, it can be a sign that there's changes, and there can be hormonal changes, physical changes. It could be that your gynae hormone levels are fluctuating in a certain way. There can be physical issues too. It could be the womb, it could be the ovaries, and the things that kind of regulate the function of all of these things together. It could be so many things. It could be you and your diet. Are you losing too much weight? If you lose too much weight, you're trying to get your six-pack out as a woman, means you have to go to really low levels of body fat, and that can actually stop your periods too. And what other options are there? Weight, hormones, things like that. Stress, emotional state, yeah, it can do it too. It can not only bring your period on early, it can often delay things and cause it to skip. So there's so many possibilities. If you're missing multiple periods, then I do think you probably need some investigation, see a doctor. Now, I think this particular patient who called wanted to see a female doctor. Is that essential? Probably for the first consult, not so much, because we don't really need to do a full-on gynae examination. We start with a discussion and then maybe recommend some blood tests to check your gynae hormone levels. And if those don't give us the conclusion, the diagnosis, you might need a more detailed investigation like a scan, which we wouldn't do. We'd refer to an ultrasonographer, x-ray department, get an ultrasound scan, check the womb and the ovaries. And if we still can't identify the cause, of course, we can refer to our gynecologist colleagues in the hospital. So that kind of gives you a very kind of brief overview of how we approach it. So there's many possible causes. Some, I guess, are more concerning and others are less so. So have a look at that, see if that gives you some ideas, if this is affecting you, whether it might be relevant to you. And if you're not sure, go and see a doctor. And if you want to make an appointment with us, hit the link. All right, hope that helps. Everyone take it easy, stay safe. We'll see you all in the next video. Bye.